So policy change in this context is really creating formal, written, either policies, contracts, procedures, anything like that, that really puts in writing an organization's commitment to a certain environmental change or systems change, and really policy is the foundation of this whole approach.
Yeah, so we think about PSE or policy systems and environmental changes as being sustainable activities to work on because they tend to be things that you can do and put the work in to set up one time or set up initially, and then once your policy is in place or your system is in place, you don't have to go back and do that again.
So I think there's a few good first steps to take when you're working towards a policy change at an organization, and they don't have to necessarily go in any particular order, but a good first step is getting the lay of the land and just finding out what policies are there already. Is there anything that you can connect with? Are there historical practices or guidances or even just traditions that are already established that you can build off of? And also, what is the process for passing a policy? Who do you need to talk to? Who do you need to get involved? Another good step is getting a core team together of people who can support and advise on this policy. We were really lucky that we have a lot of registered dietitians, we have chronic disease prevention folks, we have food service involved, contract managers, and of course leadership. And then another good step connected to that is finding a champion, finding someone at that leadership level who can help you get the policy in front of folks and can help get it over the finish line.
Yeah, so initially with our REACH funding, we really wanted to target our local stores and develop a healthy village store program where we worked with store leadership, tribal leadership to encourage the increase in healthy food options that were available to consumers in their communities. With working with a lot of turnover, also knowing that there's, a great distance and we're having to fly out there in order to get that one-on-one FaceTime. We did struggle with implementing our curriculum that we developed at first. And so we really had to pivot in the moment and find something that would work. And so what we did was just focus on small, sustainable changes with the leadership of the local stores. So we would go out and do store walkthroughs with them. We partnered with our WIC department when they were doing store monitoring anyway, because they have that familiar relationship. They're really encouraged to keep their WIC vendor monitoring. So we were able to kind of piggyback off of their efforts. And when the WIC manager would leave, to go finish her patient appointments, we could stay behind and do further education on how do you store your fruits and vegetables? Well, having them in a box on the floor, in the back by the nails, no one's seeing your fresh pears or your fresh potatoes. Move them forward, take them out of the box, put them in a basket. Don't store them near the onions. They're going to go bad faster. Just really small changes. And as we revisited these stores, we would see, the potatoes moved off the floor. We would see different options being highlighted. And we even have gone as far as providing the stores with recipes when they're like, hey, I have a bunch of canned mushrooms that no one wants to buy, making sure that they have things that participants can use.
When we're thinking about policy change, I think, again, just huge when I was able to be involved in the Alaska Tobacco Control Alliance, when the last push in taxes came through at South Central Foundation, we doubled our enrollment in 1 month. So we would usually get 100 people enrolled in our tobacco program. It went up to 200. So I think that was my first aha moment, wow, policy really works.
I definitely think that working in a rural community presents many challenges, but getting community buy-in is super important. You really have to build the respect of the community members and the community leaders to show that, what you're doing does matter and that you care about them and their health and the longevity of their communities. I've been working in the Norton Sound region for about 10 years, and it's been a lot of relationship building for sure. But I definitely think that getting their buy-in is most important, and that's where we've been unique in our approach. So whether that's our fitness program, encouraging people to apply to be fitness instructors for our community versus telling someone to be a fitness instructor for the community is a much different approach. They have some sort of ownership over it at this point once they've submitted their interest and they've gone through the application process. Now it doesn't have to be this job application or this cumbersome college application, for example. It's just a couple of questions, but the fact that they had to have that come from them, I think really makes a difference. When we first built our store curriculum, we also put that out there for store leadership to apply to participate in our program. We never want to be in the position where we're telling someone that what they're doing is wrong. That's not going to invoke change in anyone. But by offering them more tools and resources, that change comes from within them. And so getting that buy-in from them and then partnering with them in that way is great. And so we typically throw it out to all communities. We don't try to target any one community because you never know who's ready for change or who has ideas that we can build off of. And so we always send it out to everyone. And then we have some sort of questionnaire or small, little application where they express their interest, and then we reach out to them, travel out to them, and help them build a program from there. So it really has been, a lot of that relationship building has kind of determined where we've gone with our programs. We have ideas, but really the community helps birth these brain children, if you will, and carry them forward.
One of the challenges in small rural communities is that they don't operate like most larger communities in the U.S. that the CDC works with. For instance, in many communities, there are no sidewalks. So the idea of creating changes to encourage active transportation, for instance, is not really viable in the same ways. So things need to be developed according to what the community knows it needs, and it may look very different. An example would be that any conditions, for instance, that would make subsistence a more probable thing for people to be able to do, say a school district changing its calendar so that the subsistence period of time in August is set aside and that kids aren't going to miss out on school if they're actually doing those activities with their families. That makes a big difference. Then people are able to get out, they're physically active, when they're hunting and fishing and gathering what they need with their families. That social cohesion is really important, and also the connection to their culture. So all of that is going to look completely different than what another community might decide to do.